Okay, well, good morning, everyone. Thank you for joining. We are having one of our quarterly meetings of the Native Breastfeeding Coalition of Wisconsin. It seems like it's been forever since we met, but I know we were meeting frequently over the summer to prepare for Indigenous Milk Medicine Week. So we'll chat about that a little bit later too. But I just wanted to remind everyone of our mission. So if you're looking at the screen, you can see the mission of the Native Breastfeeding Coalition of Wisconsin is to strengthen and encourage the traditional practice of breastfeeding to improve the lives of women, babies, and families for generations to come. And our vision statement is that Native communities support breast milk as the first food to nourish our mind, body, and spirit. So I always like to just start out with that to remind us why we're here, what we're doing, and uh, always just to reflect on what the purpose is of our group here. I'm going to go ahead and I think I have the agenda here just to show you that as well. I had asked Marissa and Emily, who are some of the staff from the epicenter here, the epidemiologists, to come and talk about the PRAMS information. Just to remind you, a few years ago, we did a survey, a breastfeeding survey in Wisconsin, and we had talked about how we could continue to get more information. And at that time, Megan, who was one of the epidemiologists here, had mentioned the using PRAMs and oversampling the Native population in Wisconsin. So that happened. I think you may remember this was right before COVID threw things into a bit of a chaos for us all. But right before that happened, we got together as a group and we were able to talk about promoting PRAMs and reminding families and things like that. And then I think we kind of lost a bit of connection with families, but the oversampling still did occur. And so I had asked Marissa and Emily to come and chat about what the process is, what the data is available. I know they're still maybe in the process of figuring out how to put that out to tribal communities, but I'm actually going to hand it off to them to talk a little bit more about that. I just wanted to kind of refresh how we were involved in this. So I'm just going to hand over to Marissa and Emily.
Thank you, Sherry, for inviting us to be here today. I'm going to share my screen if I'm able to.
I just made you, oh, I think I have to stop. That's why.
There we go.
I was like, oh, I made you co-host. You should be there. Okay, you're good.
All right. So I'll go ahead and just do a quick introduction. My name is Marissa Hogan. I'm one of the epidemiologists at the Great Lakes Intertribal Epidemiology Center. I've been here for, like 3.5 years now. I spent my first 2.5 years up in the main office in Lac du Flambeau. And this last fall, we started a partnership with the University of Wisconsin. So now I'm located in an office down here in Madison. But yeah, it's great to be here. Now I'm going to let my colleague Emily introduce herself as well.
Hello, I'm Emily. I'm another epidemiologist, and I'm located in our Minneapolis office.
Thanks, Emily. So Emily and I are two of the staff at the Tribal Epidemiology Center that'll be working with this PRAMS data moving forward. So as Sherry mentioned, in 2020, we were able to work with the Wisconsin PRAMS program to support an oversample of American Indian Alaska Native birthing persons in the state. So I'm just going to go over a few things today. Just talk a little bit about what PRAMS is, talk about the 2020 oversample, share some data with you from the PRAMS 2020 oversample, and then open it up for a little bit of discussion and feedback from you all. So PRAM stands for Pregnancy Risk Assessment Monitoring System, and it's a program and surveillance system from the CDC that was started in 1987, and Wisconsin as a state has been participating since 2007. It's a multi-mode survey, meaning that they reach out to birthing persons in different ways, including sending surveys by mail a couple of times and then following up with phone calls if those aren't answered. Really trying to encourage participation. Some of the topics that PRAMS covers include healthcare experiences, health behaviors, health outcomes, social support, stressors, economic instability, mental health, and also there's some breastfeeding data as well. And I should have said this at the beginning, but if you have any questions during any of this, please feel free to like stop me and ask. I'm happy to answer them. So this oversample, as I mentioned, happened with a partnership between the Wisconsin PRAMS program and us at the Great Lakes Intertribal Epidemiology Center. We had a resolution approved by the GLTC board in 2019 in order to do this project. So in 2020, every Wisconsin resident who gave birth and identified as American Indian or Alaska Native received a survey. These are some of the outreach materials that were created to promote the PRAM survey. They were able to work with a Native artist to create all of these. So they may look a little familiar. So specifically for the 2020 oversample, the questions were from phase 8 of the PRAM survey. And if you're interested in seeing all the questions that were included, I can share those survey questions and the instrument that was used with you all. And there was also some supplemental parts to the phase 8 survey that were included for the Wisconsin survey, which included questions on labor and delivery, housing, and then COVID-19 as well. So our results from sending those surveys out, 49% of American Indian or Alaska Native individuals who received a PRAM survey completed it. So we got a total of 547 responses for the 2020 oversample, which is huge because normally in the past, with the way that the sampling is set up for this survey, they probably send out about 20-ish surveys to American Indian, Alaska Native persons, and they get maybe half of those back. So it's a very low sample usually. So this oversample definitely provided great data that is considered to be reliable, and we can use to have accurate estimates of what's really going on with this population. So as you can see in the past, with just the regular sampling for American Indian, Alaska Native persons, very low numbers, and with oversample, we had a huge number of survey responses. So now I'm going to go into some findings for American Indian, Alaska Native mothers in Wisconsin from this 2020 oversample. And this is just some of the stuff that we've found. We're going to work with the state of Wisconsin PRAMS program on a report, as well as different fact sheets and other materials that are going to be useful to tribal communities to disseminate this data back. So some questions and data that we got about neighborhood characteristics. Again, this is just for the American Indian, Alaska Native mothers. 18% of them always, often, or sometimes felt unsafe in the neighborhood that they were in during the 12 months before giving birth. 22% of mothers who did not receive prenatal care as early as they hoped cited a lack of transportation as a barrier. Some data on health before pregnancy. So 85% of American Indian, Alaska Native mothers self-report excellent, very good, or good health. 51% of mothers reported having anxiety. 37% reported having depression. 25% reported having anemia, and 19% reported having asthma. Again, all of this before their pregnancy in 2020, before they gave birth. Some more just stats for you. 7% of mothers said they have thyroid problems. 8.3% said they have high blood pressure. 8.7% reported PCOS or polycystic ovarian syndrome, and 6.5% of mothers reported having either type 1 or type 2 diabetes. Some information on safe sleep practices. So 6 and 7 infants born to American Indian mothers are usually placed on their backs to sleep. And 95% of mothers who identify as American Indian or Alaska Native report receiving counseling from their healthcare provider about laying their baby on their back to go to sleep. So some breastfeeding practices related to the hospital. And as you can see up here, this shows American Indian Alaska Native mothers in comparison to mothers of other racial and ethnic groups. So the blue dots are the percents that are reported for American Indian Alaska Native mothers. The green ones are for non-Hispanic Black. These teal colored ones are Hispanic mothers, and the purple are the non-Hispanic white. So with given a gift pack with formula, American Indian Alaska Native mothers, 29% of them reported receiving this gift pack with formula. 55% reported that the baby was given a pacifier in the hospital. 79% said that they were instructed to feed the baby on demand while in the hospital. And 64% fed their baby only breast milk while at the hospital.
Hi, this is Sean. I just wanted to make a comment on, if you could go back. This slide always makes such an impact on me because it's so clear the disparities are just plain as day here. You know, it's like all moms should be instructed to feed a baby on demand. If you look at the non-Hispanic white birthing persons, 91%, 91, it's like outrageous. And then the pacifier, and it's like, if we all know, it's like that mom is only there for what, 24, 48 hours. And so within the first 24 hours, when initiating breastfeeding is so crucial, you have babies being given a pacifier. And it's just, and then the gift pack, it's like, where are these dusty gift packs of formula being kept? That people are still, those shouldn't even be in the hospital anymore, but they're still finding their way to hospitals and still finding their way into the hands of moms that are saying they want to breastfeed. So I just wanted to open it up for comment. Thank you. This always just is such an impactful slide.
Yeah, thank you. Thank you for your comments. I appreciate it.
If I could just segue off of that really quickly, please, for sake of time, but I would love to keep that conversation going, and miigwech Sean for just bringing those important points forward, because I think it's just so critical to go deeper into those disparities and understand, how we can narrow that through the practices of the community support or hospital support, or where is that we can stand in the gap. So I would love to just keep the conversation going and maybe create another time and space for this, because I also felt a huge impact looking at this and wondered, why are not all mothers receiving this feedback and support? And just reflecting back to my experience with just my only child. So I'm glad that we paused here. And I would just like to keep the conversation going if we can just keep it on our radar. But thank you. This is just a great slide too.
I also have a comment, Candy from Oneida. I agree with Sean and Hannah. This is definitely something that we need to focus and work on. My question is, when you look at this data, I know here, our hospitals are Green Bay, 2 are baby friendly, which is breastfeeding friendly. So are the hospital like demographics, what they call, are they also, is that gathered from the moms? Is this real urban? Are these real rural hospitals, like Sean said, where they're dusting off these formula packages and probably don't have feasibility to be baby friendly? So I was just wondering about the hospital characteristics or demographics, which a lot of people call it.
Yeah, thank you. There is information collected on like region of Wisconsin where the mothers give birth, and also if it's rural or urban. So that's definitely something that we can look further into. I'm not sure if they collect city or county but if they do, that's something that we can look into as well, because you're right, there may be, you know, differences by place of birth and location of hospital. So I just wrote that note down. So that's something that we can look more into and explore further with this data. But like I said, thank you for the discussion and feedback, because we're still in the beginning processes of really kind of going through all this data and seeing what's going to be most useful for those who should be having access and using this data for what they do in their day-to-day work. So yeah, we welcome any sort of feedback, questions, comments that you have on any of this. So if there's anyone else who had any questions or feedback on this or one of the previous slides, please feel free to jump in. Okay. I will go to the next one then, but yeah, like I said, I wrote these down. Oh, I see someone was raising their hand.
Yep, go ahead, Sunshine. Or if you want to.
Hi, yeah, Sunshine from Oneida here, just honing in on those hospital practices. I actually have given birth twice within the last 3 years. And although I am a strong advocate for myself, and they had just asked initially, you know, what your feeding plan was, and either breast or bottle, and I had stated breast, and then that was all of it. Like, they didn't try to push formula on me or anything like that. And I actually asked for a pacifier myself because I had been in the hospital for 48 hours nursing like every hour, and I was just purely exhausted. So none of those things were pushed on me, and I delivered at St. Vincent's. And again, you know, I'm a strong advocate enough for myself. So I think not having anyone to advocate for you, or you being able to advocate for yourself, definitely plays a factor into these different ways of feeding in the hospital initially right after birth. Thank you.
Thank you. Okay. And thank you for all this feedback. I'm writing notes down for all these wonderful things that you're sharing. So this is another slide that shows some comparisons between breastfeeding initiation and duration by race and ethnicity of the mother. As you can see down here in this blue again is American Indian or Alaska Native mothers. Green is non-Hispanic, black, purple, non-Hispanic, white, and this teal color is the Hispanic mothers. So again, you can see some of these disparities in breastfeeding initiation and duration by race and ethnicity of the mother. So 65% of American Indian Alaska Native mothers breastfed for at least 4+ weeks after giving birth, and 52% for 8+ weeks. Again, this is lower than some of the other races and ethnicities of the mothers. So I welcome any sort of comments, feedback on this, on, you know, maybe questions why this may be happening, or we're seeing these disparities as well. Something more to look into.
I just had a quick comment on just the impactfulness of this slide too, and what we could do to support, you know, when mothers have to go back to the workforce, or if they're possibly returning to school, just to create ways that they can extend their nursing time, their period, and those opportunities are available. It's just my question, how I kind of look, you know, to improve that for families. So I guess that's kind of where that brings me to how we can be solution centered. So individuals who are choosing to breast or chest feed, that they have more opportunity to lengthen that time. And I also wonder, are there any studies that have been done on the benefits of lengthening that time? You know, because if we look at 8 weeks plus, what would that look like at like 12 months plus? So that's, thank you. This is kind of my thoughts there and where it brings me.
Thank you.
This is Candy. I just think we have to reflect back to their hospital experience. I mean, I work with first-time moms in the hospital, and it's literally like 50-50, them saying, oh, they really helped me. Oh, it was beneficial. They helped me latch, helped me problem solve. And others, I had a young mom say, they just handed me baby and said, okay, go ahead and try to nurse baby. She was, 17. So that hospital experience is huge.
I don't know. I don't
Um,
think he ever got
and I-
back to Mirror.
And I
From
think
what
that
she
goes
said.
forward in how long, initiation and duration. So I think those go hand in hand.
Thank you for that.
I agree, Candy. I'm sorry, this is Hannah. You just make me reflect back to my experience, and that was kind of how it was for me as well. And no one in my family nursed because of the era kind of that they came out of. So it was very formula centered from the family setting. I didn't have that support. And I actually had very limited resources in my community with lactation support at the time of my delivery. So you really raised such important points again on how we can be more community centered to keep that support once they leave the hospital available. And where can we look to fill in the gap there? So I'm noting that. And another thing, I would just love to keep the conversation going on that and how we can better serve our communities. Thank you.
Absolutely. Thank you both.
And I just wanted to say too, I mean, this duration is the reason why this coalition exists. That was the problem we were facing, is that we knew that moms were initiating, but they didn't have the support to continue to get the benefits for long term. And I know that personally, when talking with moms, and this has been also what kind of instigated the coalition and looking for funding for this, but they're getting information, or they're not understanding, or they're not getting follow through in the hospital, but they're feeling like if they don't have breast milk that first second, that first minute, that first day, that they don't feel like this huge supply, they feel like that they failed, or they haven't, met what they needed to do, without the understanding that it takes time for your milk to come in. And then the other thing that I know I hear a lot of is the weight loss. So we have families switching to formula because they're concerned about the weight loss, or they've been given that concern from their healthcare provider that the weight loss after delivery is something to be concerned about, so they switch to formula. So I feel like there's still that education before baby is born, but also right away, hitting them right away again after baby is born, to remind them, don't forget, we talked about it might take time for your milk to come in, that colostrum is great, that's all baby needs, and stomach size and all those different components that we talk about. So yeah, I think there's still that gap in education that that we're still struggling with.
Thanks, Sherry. This is great conversation and feedback. Okay. So we have some more information now about smoking during pregnancy. So this is going back to just showing data for American Indian Alaska Native mothers. So 29% of mothers smoked cigarettes during the last 3 months of their pregnancy. 6% reported using e-cigarettes during the last 3 months of pregnancy, and 18% of mothers reported using marijuana during the last 3 months of pregnancy. Just under 6% of mothers reported using prescription pain medications, either prescribed or unprescribed for any purpose during the last 3 months of their pregnancy. And 4.4% of mothers reported using amphetamines, cocaine, heroin, hallucinogens, or tranquilizers during the last 3 months of their pregnancy. And I know too, I listened to a doctor from UW here discuss about reported drug use from mothers and breastfeeding as well, and how there's disparities with those who use substances and initiation of breastfeeding. So I think some of this too is interesting to look at, reported use of any sort of substance, and then, you know, how they were treated in the hospital in regards to breastfeeding, and going and navigating through that journey, I think is worth looking into a little farther as well to see if there's disparities in that. Some information on household income. So before giving birth, 74% of American Indian Alaska Native mothers reported living in poor or near poor households, and this is based on the federal poverty level. And then after giving birth, the number actually increased to 79% reporting living in poor or near poor households. And 16% of mothers reported eating less than they feel they should because there wasn't enough money to buy food in the 12 months before their new baby was born. So some data on social supports, 97% of mothers reported having at least one person that they could call for help in an emergency. And 79% of mothers reported having a spouse or partner that could help them in case of an emergency. Some data on stressors was also collected, and stressors included a list of things, including being jailed, moving, homelessness, job loss, loss of a loved one, a separation or divorce, increased arguing with your partner, problems paying bills, and some other things. So this visualization, this graph up here, is the number of stressful events in the year prior to birth. So 18% of American Indian Alaska Native mothers reported 0% or 0 stressful events in that year prior to birth. 31% reported 1 or 2 of these stressful events. 34% reported 3 to 5 of these stressful events, and then 16% reported 6+. But it's important to note that overall 83% of American Indian Alaska Native mothers reported at least one of these stressful events in the 12 months before they gave birth. And additionally, there was a question asking about mothers feeling like they were treated differently because of their race and before they gave birth. So 19% of mothers reported experiencing interpersonal racism in the 12 months before their new baby was born. Okay, so that was just, like I said, some of the data. There's so much more that we can share as well. So there's some next steps. We're planning to work with the GLTC board again for another tribal resolution to do another oversample in 2023. And right now we're kind of wanting to gather ideas about how to disseminate this 2020 oversample data back, sharing it with tribal leaders, which we've already done. We've presented to the GLTC board. But we want to share this data back with communities and those who work in this field as well. And we want to do it in a way that's going to best suit your needs. So we welcome any sort of feedback that you have on that, whether that be the types of data you want to see, certain like associations you want us to look into, how you want to receive the data back, whether you want like a report, fact sheets, any other way that is beneficial to you. We'd love to hear that. So if anyone has any feedback on that, please feel free to share. You can also, take some time to think about it. I have my email address at the end of the slides as well, where you can, email me later on if you have any other questions or, have feedback.
There was a question in the chat about if you are able to share these slides.
Yep, I can share them.
Hi, this is Sean. I was wondering if there's any discussion about possibly sharing it at like USBC next year, like either a poster or something. It's such a unique project, and using Pram's data, and I think it would be really um, important to share just on a bigger platform so that possibly other states could look at doing oversamples as well.
Yeah,
And then it'll be really interesting to see the 2023 because this data was all gathered before COVID, and I'm so curious to see what the data will look like with the next round.
mhm. Yeah, so there was some data collected before, and there was also some collecting like during COVID, because there's questions specifically related to COVID and like their prenatal and hospital experiences and how they may have been different because of COVID-19. We actually presented a poster at a maternal and child health conference in Chicago at the end of September that talked about and showed both like numbers and as well as like direct quotes from mothers sharing their experiences about giving birth during a pandemic. So if that's something that you'd like to see as well, I can definitely share that with Sherry so you can review some of the stuff that was on that poster if you're interested.
Is that for City Match?
Yep, it was.
Oh, nice. That's great.
Thank you.
Go ahead, Hannah. I see you have your hand raised.
Hi. I just wanted to also offer the opportunity of sharing back with the community through the infant mortality reduction plan. Murray has been heavily involved with like leading the framework of the plan and how PRAMS applies to different sections. So it's been a growing process, and at any opportunity, I welcome more conversation on that just to highlight the data appropriately. And then it's just a great platform to share back with communities. And as Sean mentioned, the opportunities other states have to look at it, and we could provide links within different parts of the plan to bring, the readers to, other information and resources. So, if you wanted to follow up and earmark that as another thing to talk about, I'm always available as your time allows. And then I just also wanted to mention at this time how we're sharing back with communities on just the work of the coalition and how you would like to highlight those parts, and through through like the next couple months as people have capacity, if you just wanted to reach out with me and keep that discussion going, and just to let you know I'm available.
Great. Thank you so much. I appreciate it.
I had a question going forward with the 2023. Is there possibility of adding additional topics? Did I hear that correct?
So how PRAMS works is they use the same survey. I think it's for like 3 to 5 years. And then after that time period passes, they review the questions to see if they want to continue using them, change some of them. And they're actually, I think, in the end phases right now of going through those questions that they've used. So the 2020 or 2022 year will be the PRAMS phase 9 questions. So Murray, who Hannah mentioned, is our partner with us at the Wisconsin PRAMS Project, and she has asked for some feedback on things that we could consider for this new phase. So I'd love to hear them, because I'm not sure where they are in the process, if they've already kind of decided, but I can still share those with her too if there's still some time to add topics for this next phase.
Yeah, because I think the questions that you're asking are going to continue to be of relevance, as far as discrimination and like I had said, more information about the hospital demographics would be interesting. And then I know a lot of this, we talk about how women are treated, and then lack of prenatal care, and then hospital practices, obviously would lead to low breastfeeding initiation and duration. But I'm also curious, with my prenatal hat on, is method of delivery. I did talk with Fiona and I worked with her. She was using the PRAMS 2020 information for her dissertation. And I had mentioned that just because it's another racial inequality also of stagnant C-section and then decreased VBAC. And it goes back to that, is there shared decision making with mom and providers, education being provided, types of things. So I mentioned that to her too, is American Indian Alaska Native method of delivery rates.
Thank you. Anyone else? And if you need to take some time to think of it, totally fine. I'll provide my email so you can email me at any point with questions or comments as well.
And just to reiterate, Marissa's looking for like, how can this be shared? She mentioned like fact sheets. I forgot what else you mentioned, Marissa. Can you just recap?
Yeah, just like basic things, fact sheets, reports. But those are, like I said, those are what we normally do. But if there's anything that's you think would be more beneficial than just a fact sheet or report to share this data back with communities and with the people doing this work, I'd love to hear it.
I do have to say, some of your slides, the one about the stressors, how many people are hungry still. I feel like there's resources available, and how do we get to them? As particularly as someone who works with WIC, like we have a connection to food programs. So, that's really heartbreaking to see that there's such a percentage that felt like they were still not getting the resources they need. So I think that's something that us as community health workers and public health workers it's very impactful. So I definitely feel like there needs to be a way to share that, to remind us some of the things that I think sometimes slip as we're doing day-to-day things, but to still push forward and remind people about what's available. And the stressor thing, oh my gosh, I feel like that's just a whole nother venue of how can we help families. So Hannah, go ahead. I see you. Is that still from before?
No, yeah, you just provoked some more thoughts with your comments that I just wanted to just ask a little bit more for perspective on possibly how we could reach those families, because that really it caused me to pause too with that slide. And I started to think with the transportation issue, and really demographically, some of our offices are dislocated from a lot of different communities where potentially moms just can't get to those locations to apply, or, even up in those rural areas, our phones just don't always get through that application process where you click submit and then it wants to sit and spin and tell you it can't connect. So what those barriers are potentially, and how we can work better to make it easier to access those resources, because I start to think of like transportation and internet and what that looks like across different communities.
I also had a suggestion as far as data being shared would be, in the past, I had received like the infographic sheet, which is great to review as a prenatal provider, but also I really want the OB providers that we contract with to be looking at this data. So they know what our women are dealing with, what they're lacking, so they can connect with the proper resources. Here in Oneida, we're fortunate to have a contract with Prevea, so our providers come right to us. Many tribal clinics have their women go to the nearest city to receive prenatal care. And do they know about all these barriers and risk factors and what Native women are dealing with? So I'd really like to see something in the form of, here is information from the 2020, because this is rare and very valuable information. There's hardly any information collected that is the sufficient size. We talk about research studies like, oh, we're not have enough research because there's not the size, the sample size isn't large enough. So oftentimes where we are ignored. But this particular thing, it needs to be a message loud and clear and provided with our OB providers that see our Native women to say, hey, stop and, think about A, B, and C, or, help them create a checklist to make sure their needs are met. So that's how I would like to see it, is something to share with the OB providers that the tribal clinics work with.
That's great. Thank you. Anyone else?
That was such a great solution, Candy. I think that was so solution centered and it's so achievable and possible. I don't know if you're aware of the group called Cofective that's working on hospital practices and piloting different programs. And I can connect you with those folks if you'd like to maybe have some discussion with what they're doing and see if some cross collaboration can happen.
Yeah.
Sean, aren't you on Cofective too?
They're one of our partners through Title V. Yeah, I think a lot of them have connections too through WIC and.
Okay.
Yeah,
Yeah,
I
that
actually
would be
wrote a
great.
note to connect with Amber again because we had been kind of connecting on how could tribal entities connect with the resources of Cofective. And then I think summer came and things happened. And so I have a note to connect with her again. So maybe that's some way that Marissa and Emily could be a part of that as well. So definitely got that on my list, Hannah.
Because when we talk about that particular slide that the breastfeeding hospital practices, I mean, all of us were like, whoa, wait a minute, Sean, like, where are they getting this formula from? So I think Coeffective is the solution to that for a lot of these communities. So yeah, if we dive into further of that, the data on that, the racial disparities, I mean, it's basically the clinic communicating with the hospital staff and making sure we're sending the same message, giving the same message and support to moms. So I think that in the end is probably a solution to combat some of these, bad hospital practices for our women.
Thank you. This is all great feedback. I appreciate it. I think we may have touched on some of these, right? The topic areas that you feel are the highest priority to be addressed, the hospital practices. Is there anything else that you think are important areas to address or of highest priority?
I still think the 19, basically almost 20% of women saying that they experience interpersonal racism as a pregnant woman is going to lead to all types of, health disparities for mom and baby. And I think Wisconsin and most of the nation are what do you call it, hot topic, or the keywords are trauma-informed care, is it bias training, all that stuff. So obviously that needs to be revisited or suggested again for these larger organizations like hospitals, big clinics that women are going to. 20% is huge. Most 1 in 4 women are feeling mistreated during pregnancy at a most, vulnerable time of their life. It's just not right.
Thank you.
I feel that as a priority too, and I'm wondering, just like access to traditional practices and midwifery and doulas, and trying to, I see how we don't always attach the emotional element to pregnancy, and just pausing for a minute to understand how sacred the data is when we bring this information forward to the communities. And perhaps that is part of the solution with that, and how we can look to the traditional practices and start to revitalize that within our youth, so they're comfortable and they feel safe. So thank you, Candy, for bringing that forward, because I feel that as well. And especially when we have young moms who need that space, where is that physically located, and how can we just through the community start to bring resources, whether that's, you know, through education, but still having a birthing skirt or a nursing shawl or, you know, a cradle board, and what does those traditional practices mean for that particular community, and where are those activities happening, is always my question on how we can narrow the gap. And perhaps through that process, we can start to, you know, have that emotional element, you know, more prominent and powerful, where it's really making the whole experience, like Candy says, that very vulnerable time is empowered.
Thank you. Okay. So here's my email. Feel free to jot it down. That's my office phone number as well. And this is the contact information of Murray, who is the program director for the Wisconsin Prams Project, who's our partner with all of this. So yeah, again, I appreciate all of this feedback and comments that you had for me. I look forward to continuing conversations around these topics. And if anything else comes up in the meantime, please feel free to reach out to me. If you have any other questions or ideas, or maybe you know someone who could benefit from this data and you would like it to be shared with them, please let us know. We want to make sure the data is getting back to the communities for those who want to see it and use it.
Thank you very much, Marissa. Wow, I think this has been a really valuable conversation. Like I said, I've been jotting down notes of things to follow up on and things that the coalition can maybe take some action on as well. So I really appreciate you and Emily taking the time. And I think we might be making some other connections with you just from things that have spurred here today. So thank you guys again. To the group, I can connect you with Marissa, or you have her, you saw her email. I think you said you'd share the slides so we can get that out to everyone as well. So again, thank you guys for joining us. And yeah, really exciting information. I think Candy or Hannah said that this is such a amazing, you know, 50% of people essentially filled out the survey, which is amazing. So we're really excited to work with that data. So thank you guys again. Feel free to stay or go or whatever you need to do, Marissa and Emily. But again, thank you for taking the time, and we'll be in touch on other things, I think, from the conversation. So again, thank you guys. And we will jump back to some other business for the coalition. I can get myself, here we go. Okay, I just wanted to give some time.
Hello.
Yes, did somebody have something to say?
Oh, this is Sharon. I was wondering if I could get the slideshow sent to me. I
Yes,
wasn't able to join through the camera. It said the link wasn't, it was invalid or something, so I had to call in. I couldn't
Okay.
see any of the,
yep, I'll send you both slideshows so you have an opportunity
Okay.
to look at them. Yeah, because it was really good information, so definitely.
okay, thank you.
Yeah, you bet. I'm glad you joined, Sharon.
Well,
Um,
I've been here since 8:30. I heard everything. I just couldn't see anything.
Yeah, I saw your number and I thought, I think that's local, so it must be either Sharon or Jody or someone else at the health center, so.
Okay. All right. Well, thank
okay.
you.
Yep, you bet. Okay, so I just wanted to jump into some updates. I know everyone, it's like I said, Indigenous Milk Medicine Week was kind of our last connection. So I wanted to see if anyone had any updates or anything they wanted to share from their events of that week or since. So I'm just going to throw it out to open up to whoever. Actually, I'll start with LCO did give me a little in update here because they had to sign off. So they had a breastfeeding event at at LCO College on August 19th, and they collaborated with multiple partners, the maternal child health department from LCO Clinic, and then their Head Start as well. They had a nice turnout, not a ton of pregnant women, but a handful. They did a display with resources available, and people appreciated the information that they had and items they could take, the t-shirts, etc. So that was their update for Indigenous Milk Medicine Week. Anyone else have any updates or want to talk about the information or the activities of the week?
Sherry, are the recordings available yet?
Yes, we actually had done a recap on Facebook and shared all the recordings, but I can do that again, send it out to everybody individually.
Okay, thanks.
Yeah, because we did record, so we had done the lactation support for breastfeeding. I did not record the Q&A, just because people were sort of talking personal things, so we didn't record that one, but we did do the nutrition and breastfeeding presentation that Casey did, and then the traditional foods that Candy's Aunt Vicky did. So we do have those available to share, and I can send those out again, the links. Yeah, we actually have quite a little library of things we have done, so be sure to check those out again.
Quick question.
Uh-huh.
Are there any yard signs left yet?
Does anyone have any out there? I'm just wondering if anyone has any that they'd want to share. I know I got rid of all of mine.
Okay, I can catch some on the next round maybe, but those were so beautiful. Just loved them when I pulled up to your building. I took some photos, but I loved them. So if there are more, I would stop and grab one.
Okay, I'll see if anyone else has any available. I know Jody might hear in Lactaflam, but I'll check with her. Was that her? Oh,
It looks
Kathy
like
has one
Kathy
in
might have
Menominee,
one.
yeah.
Oh, super. Thank you.
Any other exciting updates? I know I'm gonna just say Amaris and Redcliffe, she did a breastfeeding walk as well. So she was able to, she got pictures of some of the families using the banners, and they did a walk, and with the walk, they earned a t-shirt. And I think she had more people attend the walk than actually got a shirt, but yeah, so I know hers was a very successful event. Anything to add to that, Amaris, either in the chat or if you can?
Yeah, it was a great turnout. It was like my first one, so I was very happy about that it turned out so well. And then I have plans for next year, so that was helpful, just getting in there and figuring that all out. And then after this, I was going to bring a question up about I forgot. Oh no, about what. So now, we're done with that, and then we have other things coming up, but how we can, if anyone has ideas or whatnot, to continue like the breastfeeding support, whether it's like every other month or around holidays, or what they do in their communities throughout the year to keep it up. But that can be at the end or a different time.
Yeah, and that's actually something I think we talk about all the time. And if you see on the agenda, I have Native American Heritage Month this next month. So can we do something that, what can we do that highlights breastfeeding and as the first traditional food or things
Yeah.
like that. So definitely we'll get to that discussion too.
Great.
Yeah, and congratulations to Amaris, because I know she was a little stressed out and just did a great job putting that together. So so excited that Redcliffe got an event this year. Let's see, I'm just gonna say, and Casey or Anita, if you're on as well, I just want to mention that they did sort of a giveaway of their the t-shirts and the yard signs, and people had to submit a story or a picture, and they were using the hashtag Mohican Milk Makers. So if you were on Facebook at all, we shared those as well on our page. So there were a ton of those that came through. So very successful, I think, attracting attention with that particular hashtag and getting families to submit pictures and things like that. So I don't know, Casey, if you had anything else you wanted to add.
Yeah, it was just nice because it got more people involved than just the moms. Like we had the dads submitting stuff, grandparents, siblings, all that kind of stuff, even like people that are wanting to breastfeed in the future.
Mhm.
So that was nice that it included a little more people. And then ours happened to coincide with our powwow. So we had a breastfeeding tent there that got utilized by people at the powwow. And then we just did some stuff for the WIC week too, the WIC enrollment week. We had like a board and some giveaways up on our atrium for that, and that was like well participated in as well.
Excellent. Yeah, I know. I know you mentioned your breastfeeding tent at the powwow. Is usually very well attended or used, and I know Menominee did one as well at their powwow. If I remember, I got a picture of that. Anything else from your end, Kathy?
I was just gonna mention, yeah, we did the tent, and after a couple year hiatus, we went back, and it was smaller than it was in the past, which was actually a good thing, a little bit more manageable. Unfortunately, we had some bad weather partway through the weekend, so some of the festivities got moved. So I think the tent may have gotten used a little bit more had it stayed at that location the whole weekend. But yeah, we had a few people sign in and say that they appreciate it. So as far as I'm concerned, it was a success. Looking forward to doing it again next year.
Oh, good. I'm glad that that was doable for you guys. I know that you mentioned the work involved and whether you would be able to continue it. So I'm glad you were able to find a solution to at least have it available. I see Heather, you're on from Ho Chunk. Is there anything? I honestly don't know what you guys did.
Hi. Sorry. Ours was kind of quiet this year, but we still had one event over in Black River at our tribal executive building. So we had one breastfeeding event there. And then the weekend before that, we also had our general council. So we're able to set up our breastfeeding tent and get some of the yard signs out there too. So it worked. It coincided well with each other.
Excellent. I knew you had done something. I just couldn't remember what it was. So yeah, glad you guys were able to do that as well. Let's see. I know Jody is on. So Lac de Flambeau did an event too with some just having families come and pick up yard signs and get the t-shirt and take a picture for us with the banner and things like that. So I know they were active during the week as well. I know Jody is on maybe from the health center. If you have anything else to add, Jody, feel free to do that or put it in the chat. I don't remember the exact number of people they had, but it was quite a good turnout because she sent me quite a slew of pictures. So always exciting to get those. Okay, and Candy, I don't know if Sunshine is still on. I mean, Candy pretty much single-handedly provided all of the education the week that we did that with her session on worksite support, and then getting her aunt to do the traditional food cooking lesson, and she kind of was the moderator for that. So I really appreciate your contributions, Candy. Was there anything else you wanted to mention as far as Oneida's efforts?
No, that was a great fun week. I know I got a lot of people asking me for the recording. My aunt had made cornbread, corn mush, and kind of demonstrated how to cook corn for corn soup. I mean, like, I learned a lot. It was a really fun day. And then we were able to give those kits out to our Oneida Cannery here. It's kind of like reorganizing, but I guess in a good way. They were making individualized kits, and then we gave them to moms, and it had the white corn in it. And then I think it was nettle tea, and they even made some homemade nipple cream. So it was like a breastfeeding wellness kit. It was a big hit here in Oneida. We're definitely gonna get some more of those. And then like I said, the food demo, a lot of people who weren't able to make it, they were like send me the recording. I want to learn how to cook white corn, because we take that for granted, I know a lot of people that do it. I probably could myself, but it's really good getting back to traditional foods and, having women learn from other women. So it was a fun week.
Yes, and I will definitely share that with you. Sorry you didn't get it earlier. I thought it had gone out, but I will make sure that everyone gets it, because it was great, because she also mentioned some of the stories that connected with corn and breastfeeding, and just a lot of information culturally about that was related to corn, but also women's health and breastfeeding. So it was really a great effort. Okay. Anything else as far as tribal updates? Anything other than, even outside of Indigenous Milk Medicine Week? Otherwise, I'm going to throw it over to DHS. Hannah or Sean, did you guys have any updates you wanted to do?
Hi, this is Sean. I was just going to say that many of you probably have seen that Title V has put out who is going to receive funding. We had like some additional funding for next year. And so those award announcements have gone out last week, and those are for 2023. And for breastfeeding, we have several new partners that are focusing on breastfeeding, which is exciting. And so I'll kind of keep the coalition up to date as, if there's opportunities and such to be involved. And then also for 2023, breastfeeding will still be a performance measure that local and tribal agencies can select. So those contract negotiations are happening now. For those of you that work in your maternal child health or have connections to that unit, you can get in your word, put in a good word for breastfeeding, so your agency can use Title V funding to support breastfeeding in your community. And then I did have just a question for the group. I was wondering, we're looking at some PNCC support and some projects within the tribal community. And I was wondering, who does PNCC? I know everybody does, maternal child health visits and such, but which one of the tribes, and I think Candy, you do at Oneida, that does the actual PNCC with the billing?
Correct. Yep.
Okay. Does anybody else, does Lac de Flambeau or LCO?
I believe Lac de Flambeau does. I don't know if Jody can verify that. They just hired a new nurse, so they may just be kind of getting that back into the swing of things, but they were doing PNCC in the past.
Yeah, we haven't really started it back up yet because Polly just started.
Okay.
So, yeah.
Do you guys do the billing and all that stuff too for it?
I don't think so. I think Makila maybe had started it. I'm not sure.
Okay. Anybody else know of any other tribal agencies that are doing PNCC?
Sean, the Ashland Birthing Center described a lot of services that seem to be PNCC, and she, with the whole coding process and how those codes changed, I think she could use some support. And I'm pretty sure she was one of the ones that was awarded funding. So this might be a good opportunity to connect her with the group. And then also maybe, I don't know who would do that, but when I did a one-on-one and a site visit, it was really exciting work happening, and a lot of it seemed to align with PNCC work. So we did kind of mention where we would look to, and I think I connected her. We might want to follow back, but or circle back to see if we can assist in that, or if she was connected with a person, because isn't there like a link that people can visit?
Yeah, on the Forward Health site.
Okay, yeah, I'm pretty sure I provided that to her then. So I
Okay.
don't know if that was helpful or not, but I'm pretty sure she might be potentially a location that could be providing those services and maybe going through like through the process of billing them. I'm not sure where it's at.
Okay. And this is for a specific project, and I think they have to be already doing PNCC because
Okay.
they're studying. There's some pieces to it where they're going to be studying how it's working, and so
Okay.
but more to come on that. I just because I was already here with you all today. I was like, oh, I'll just ask right now if anybody's doing it. And so thank you. And then I don't think I have any other updates, just that, we're really excited about the 2023 grantees, and there were several agencies that work with tribal communities funded. So we're really excited about that.
Sean, Mrs. Candy, what I had found out when I first started was like Brown County, the neighboring county to us, did PNCC, but because of the reimbursement being very minimal, they, instead of calling it PNCC, they kind of wrapped it within a home visitation program, which I think
Mhm.
Kim does too. So Kim
Yeah.
Hill at Menominee. So you ask if she does PNCC, she kind of says yes and no, because you're kind of doing that same prenatal stuff, but eventually turns into, I don't know which curriculum she used, but because I think the bulk of the huge grant is that home visitation part, and then they may do PNCC. So it's kind of hidden for, I think,
Mhm.
not necessarily called PNCC. Like my position is particularly prenatal care coordination. And yeah, I don't know we don't do that, but other tribes have kind of engulfed it, instead transitioned to a home visitation program with PNCC within it, if that makes sense.
Yeah, that makes total sense. We hear that kind of across the board with, um, local health departments, like county health departments, and then tribal health departments. And so, with the MCH program, it's PNCC is housed, under Medicaid, as you know, and so we try to just act as, support, just because we're serving the same population of people, and we do provide that feedback that, that's what we hear, that, people are nervous to do the billing, and people are,
It's a lot of work. I mean,
yes, the billing is
there's
confusing, and yeah, especially for smaller agencies, because it's the nurse doing the visit and then the nurse doing the billing. So,
on top of many other hats, because
yes.
it usually resides within a public health department. So after maybe a few years back, they started with audits, and a lot of agencies just opt out. They're like, it's not worth it for a couple
Yeah.
foul here and there. So they stopped
Yeah.
doing PNCC. So, I mean, that's education taken away from a population that probably needs it.
Yes, definitely. And that's what we are hearing, that those, the effects of those audits are still being felt in communities as far as wariness to bill. So I know that they're really revamping the whole program right now, and they're coming out with, some new ideas and things. And so hopefully we'll see all of that rolling out soon. But thank you. Appreciate it.
And thank you, Sean, as well. Any other DHS updates?
Yeah, I just wanted to mention that I welcome an opportunity to meet with anyone and go deeper into discussion on, highlights for the infant mortality reduction plan. We are working together to do a section on breastfeeding, and just how you would like to see different things highlighted, and making sure that we're aligning everything and collaborating with people, and that we all have a place there. So please feel free to reach out to me at any time if you'd like to be a part of that. Like I said, we're still in the developmental phase. So there's going to be like a part 1 and a part 2, and just kind of breaking that down and working through that. So please, just putting that invitation out there. If anyone wants to connect, I welcome those discussions.
Thank you, Hannah. I will make sure that that gets in the notes as well, that infant mortality reduction plan, correct?
Yes, and like I said, we're going through, it's just drafting yet. It's just a developmental time. So we're working on the breastfeeding section with Sean, and just covering different programs and WIC. So I guess at this point, just it's a really exciting time because we're going to be, popping graphics in and kind of doing, if like you have ideas for graphics, I know with the toolkit, I would really like to link readers to the toolkit for the Indigenous Milk Medicine Week information and that toolkit. So that the platform is a really good opportunity to communicate information to providers, the community. So anytime you have to, maybe look at different things to highlight, there's just a lot of opportunity to do that throughout the different phases of the report.
Okay, excellent. And we'll keep in contact about that and see how the coalition can continue to support you in that role as well.
Oh, I appreciate that so much.
All right. Any other updates from anyone in the crowd? Okay, and feel free if you think of something later and want to send me something, happy to share it as well. I did have coalition leadership on the agenda. Initially, we were created with our bylaws, and I don't know, I really haven't probably stuck to those bylaws very well in the past 3 years. But we did structure ourselves with a vice chair, a vice chair, a secretary, a treasurer, I believe, and maybe a past chair to be a leadership. We struggled a little bit with people who might be interested in those, and obviously, I think the person elected for president, the person elected for vice president, the person elected for secretary, none of them are active in the coalition anymore. And then when we were supposed to redo it, COVID came along. So I guess I'm kind of presenting the question to the group, and I can always do a follow-up survey monkey to just get some feedback, but I wanted to put it in your mind. So we could go back and do elections again to fill those positions, or we could just get a couple of volunteers to create a leadership committee, instead of going through the process of that. And then that way the volunteer committee could maybe serve a year or two and then decide to continue. Really what we want is just someone a team to assist with decision-making, to provide feedback on coalition business, and then to help to build the capacity of the coalition as well. So let me just, any thoughts right off the bat? Otherwise, like I said, I can do a survey monkey to people and get just an official vote. And maybe I'll do that anyway, but just wanted to hear some thoughts on that, on the leadership aspect. Or if you don't care, that's an option as well.
So did we have at one time a chair and?
Yeah, we did have a chair. I think Suzette Mayat, or what was her name at that time? Anyway, Suzette here from Great Lakes was the chair. Shanoa was.
Yeah, that's when I remember.
And then Mary Tribble from LCO was elected for either treasurer or secretary. Oh, Amber Webster from Oneida was one of the other two.
Yep, those were our home visitation gals that we no longer have.
Yeah, because I think at that time their positions were eliminated. The funding went away for Healthy Start, and they were off to other things. So yeah, there really wasn't much of a run with an actual leadership in those roles. So, and I didn't know, people feel sort of uncomfortable. I think it felt like people were uncomfortable running as so to speak, as an election. So I just wanted to kind of get some feedback about what people felt would be most appropriate.
Are you saying we have to, or it's just a suggestion?
I just feel like we need someone else other than just me as far as deciding things. Because I'd really like to have, not only just to help other people get some opportunities to lead, but also to help with decision making. Like I just sort of, and I don't know, maybe that's fine with everybody else. It just feels like I don't want to make decisions for everyone. And it would be good to have, and I kind of do. I think Candy, I use you a lot. I use Sunshine, I use Casey and Anita, but something maybe more official. And if that doesn't make any difference to anybody, that's good to know too.
Yeah, you can make me the official sounding board or if you need to, but I think all of us, when we come together, we totally appreciate your leadership, the promo type stuff that you provide, kind of like, remember we all say we have 10 different hats in the meetings, and the things that you provide just make it a little bit more easier to do what we do. So I'm thinking, I don't speak for everybody, but everybody's probably going to be like, I don't have time,
Yeah.
thinking it's a big time thing, but
even if I had, like I said, I do use you. Is that okay? Like, would you be interested in sort of officially being part of the, I don't know, feedback committee or whatever we could call it, like I just don't want to push, like you said, I don't want to push it onto anyone that doesn't want to have me harassing them every so often. So how about I'll put it out and you guys can do I'll put it out in a Survey Monkey and let people give me their opinion. That way nobody has to feel pressured to say one way or the other. But then I can get a good sense of whether it's something people care about or not. Yes, and like Kathy said, I'll give you some time to think about it, and then we can come back to it. Okay, I just wanted to give a few quick grant updates. I know we are close on time. The first foods grant, so I know Candy mentioned they definitely did excellent work with their food boxes. The first round we were able to get out, that was the wellness box. It was amazing. I have a picture of it I should share with everyone. So we're really excited. And then we're working on another food box, which is kind of like with shelf stable items. And what it's going to be is it's just going to be one recipe that we put together with the items, and we'll send it out to tribes to distribute to some of their lactating families. So it's for obviously for breastfeeding families to improve their nutrition and to offer them information about traditional foods as well. So we are working on that and we will get that out before the end of the year. So watch for that. Otherwise, the last thing that will happen with that first foods grant is going to be the breastfeeding indigenous lactation counselor training, which I believe is still scheduled for the first week of March. I will get some more information out about that because man, that is coming really quickly. So that'll wrap up the first foods grant. If you were on the call, I believe in July or maybe June, we talked about the opportunity that First Nations grant making organization gave us to do an Indigenous birth practices grant. So Candy and Hannah and Sean and then Hope Mayat from Bad River got together and we came up with a few objectives, and we actually got that approved. It came a little later than we thought, but we are working on this grant for Indigenous birth practices. And I think with this discussion today, it might help us to connect to some of those issues that we were seeing with that data. So I'm looking for any interested parties that might want to whether it just is at your site or if you can connect me with people at your site that might want to work with this information or work with this Indigenous birth practices and breastfeeding grant. But we really want to create some materials for the Wisconsin tribes, and we want to provide one education session for providers. And then we are going to do some prenatal and postpartum support group sessions as well. So if you have any interest or connections in the community that could help us with that, I would greatly appreciate it. We're going to try to get started. I'll probably be harassing Candy, Hannah, and Sean again to play with this so we can get that moving. But we are really excited about this opportunity. I think this connects really well with some of that, making sure families are well supported during the prenatal and postpartum period.
Yeah, feel free to call on me whenever you need. I'm happy to help.
Okay, excellent. If anyone else at your, if you have, if you're thinking about your tribe and who we could connect with and how to, what you're thinking about for your community, I would love to hear that. We're kind of going to probably start a little slow and plug our way through and see what we can get done with this one, but we're really excited. This was something, we were just offered because we were working on the other, the First Foods grant. So definitely wanted to take advantage of it because I think this is really an area that people are interested in, and I definitely ways to tie the breastfeeding information into as well. So stay tuned on that. Okay, I'm going to jump ahead. Meeting dates. Did I skip one? No. So I just put on the 31st of January for our next quarterly meeting. I wanted to see what people were thinking as far as April. In April of 2020, we were going to do an in-person in, I think in Ho-Chunk in Wisconsin Dells. So, and I could send this out again as part of the Survey Monkey. Are we thinking in-person could be a thing again, or are we thinking no, let's stick to virtual? So another thing to think about, I will put it in the Survey Monkey, but think about whether you would be ready to do an in-person. If obviously we would stretch it to be a longer day. In the past, those have been pretty much like 9:30 to 2:30-ish type of meetings. So we could really accomplish a lot, I think, in something like that if we had that opportunity. So yeah, put that in the back of your mind to think about as well. And I will be asking for a thought on that as we go forward. I think I've covered everything with the agenda. Oh, I did want to mention Native American Heritage Month, and in connection with what Amaris asked, I think if anyone had ideas about, what other things are you doing throughout the year? What can we do to continue support? I know I was looking for, and I think I might have convinced Sunshine to do maybe like a monthly or twice monthly support group that would be available to everyone. Just to continue to have that connection. We're also looking for, it's been a couple months since we've done any intertribal education and support sessions. So I'm very interested if anyone has any ideas. Some of the things we talked about today would be great as far as, what are some, in the first 3 days, what should moms be considering, or first 2 weeks, or even something about prenatal breastfeeding education, the basics of breastfeeding. If anyone is interested in doing that or knows of anyone that would love to do a session, let me know. We're really interested in putting together some more of those again. Just as a side note, I know there were also some families interested in more of the nutrition aspect. So if you have some interest in that and want to go that route, doesn't have to always just be breastfeeding, but definitely something maternal child health, family related. Also looking for pictures. So if anyone is wanting to do an event and we can hire a official photographer and do an event around that, we would love to do that as well. We're always looking for pictures. So if there's a way we can incorporate that into an event in your community again, let me know. And I wanted to also mention, sorry, I'm way off script now, but I'm just cramming it all in the last 4 minutes here. earlier this year, I did apply for us to be members of the US Breastfeeding Committee. So we did finally get our membership through, and free of charge. For whatever reason, they had a scholarship program going on. So we are covered for 5 years. I had to identify some, I forgot what they're calling them, but some members that would be sort of like contacts for the coalition. So I know I did Sean and Candy, and I honestly can't remember who else I put in there. So I apologize. You may have gotten an email in the last week or so. It's not an error. We ask you to please be willing to fill out the paperwork, I think is all. There wasn't much that you had to do, but we just were excited to be part of an official member now of USBC. So questions or thoughts about what you're going to do, other events throughout the year, anything you want to close with at this point? I want to give you a couple minutes to get some last thoughts in.
Sherry, this is Kathy. I have a quick question. So I received about a week ago a package with some fleece sweatshirts with.
Oh yes.
Yeah, what's up with those?
Well, okay, so first of
you.
all, I'm gonna jump back. The t-shirts were a little costlier this year, so we didn't have as many, and I apologize for that, but we can talk about next year. Gerald Ignis, for example, ordered more and they paid for them, so we have that opportunity to do that. But as it turned out, I had some extra money and I had to scramble to spend it. So I had bought some fleece jackets, and I think most of you on the call already got them. I do have
Yes,
to say,
thank you. I said, thank you for the Christmas present.
yes, I do have to say they were small. Sizes were a little small. I did women's and I was like, oh my God, these are really small. So I apologize if they don't fit. You can do, the intention was they were for our membership, but if they don't fit or you don't want them, feel free to use them as a door prize or whatever works for you. So yeah, it was just like use this money really fast. And I loved our logo. I just wanted to say a thank you to Anita, who repurposed the logo a little bit. And I really love the strawberry, particularly since this year we were really focusing on the first food. So I think we may stick with this version of the logo for a while.
Sherry, I can reach out to, we hired a new peer counselor here.
Mhm.
I see she's not on the call. I think she's here Tuesday, Thursdays, Makanit Gutierrez,
Yeah.
to see if she's interested maybe in doing a session. So do I say like, were you doing them like every Tuesdays at 11, which would work for her?
Yeah, we were, that was our date. Yes. Yeah, date and time. We are flexible. We've had to
Okay.
change it for different things. So if Wednesday works better, or no, you said if she wants to do it outside of work, we can do that with her. I mean, I do have some funding I could reimburse. That's another thing for if you have a community member or someone else who might be willing to do a session, we can provide a stipend of some sort for them as well.
So you're just looking for one a month, starting maybe next month?
At least one a month would be great. If somebody wants to do something, I was thinking like with Sunshine, maybe like just a community discussion. So it would be a little less formal. If, however often we want to do those as well. But yeah, once a month at least.
I'll get back to you.
Okay, thank you, thank you, thank you. Any other thoughts or questions, concerns? I know we're at 10:01, so I want to be respectful of the time that you guys have already committed. Let's check. And I'm not seeing anything in the chat. So feel free if you have ideas or things that you have done that you could share with the other members. We'd love to hear those, put them together, give people ideas of things they can do outside of just 1 week of the year. And otherwise, I will get the notes out. I will do a little Survey Monkey so you can consider the in-person and leadership of the coalition, what that looks like to you. And then, yeah, we'll plan to reconnect in January. I'm always available if there's an event you're looking to do, or if you want to connect more about the Indigenous birth practices. We really value your input and want to support the events that you have going on as well. So reach out to me anytime. I think that's it. I will close. Thank you, guys. Feel free to put anything last discussion in the chat. Otherwise, thank you. This has been a great meeting. I really appreciate that we were able to have a good discussion about the PRAMS data and look forward to what that will bring for us as well. Otherwise, happy Halloween, happy Thanksgiving, Merry Christmas, all that until I see you guys again.
Bye.
Bye, Hannah. I'll be in touch.
Thank you. Yes, looking forward. Bye-bye.